Welcome to tonight's webinar. My name is Greg Chernoff. My practice is limited solely to aesthetic, plastic, and reconstructive surgery. As well, for the past 30 years, I've had the privilege of acting as an alpha and a beta test site for the majority of the laser energy companies, as well as companies bringing new technologies into the marketplace. We've also been involved heavily in the fields of cellular medicine, regenerative, and stem cell therapy research. And it's really my pleasure to present tonight's webinar this evening as it relates to technological advances. Dermoelectroporation would really top the field of one of these for several reasons that will go on for this evening. I'm going to show you some of the science and then some befores and afters, and then we'll save time for questions. In cellular medicine really should be very familiar with the current FDA's positioning as they stated on June 3rd of 2021, and certainly adhere to the FDA guidelines within your own practices. The whole field of regenerative medicine, and we speak about this because this really is where dermal electroporation or DEP is really, we've spent the last 3 years because from a exosome standpoint particularly, there is no company of exosomes that currently has FDA approval. And so currently the applications of exosomes must be performed topically. And in prior to DEP, again, we would use things like microneedling, needle radiofrequency. But again, very few people like needles. Many patients have a needle phobia. So anything that we can do to enhance the absorption of any products that we're putting on topically are tremendously valuable. And whether it's exosomes, any other form of secretome or extracellular vesicles, must be applied topically. And DEP has allowed us now to maximize the topical absorption of anything that we're putting on the skin up to 800 Daltons. And we'll discuss the many different combinations or soups, as I call them, of varying products that DEP is and will be producing for your utilization for really whatever skin issue a patient is dealing with. So the whole field of regenerative medicine has become very interdisciplinary and focusing on different applications for the repair, replacement, or regeneration of cells, tissues, or organs. But what is important is that what you're doing is restoring impaired function, including many different issues. And this slide really shows what the current literature shows that we're able to regenerate in the extracellular matrix. We've seen that various topicals can enhance fibroblastic regeneration, collagen, both types 1 and 3 elastin, proteoglycans, as well as being a contributor to angiogenesis or improved vascularization and wound healing. And so this is really all of the different things that are available in the marketplace right now, where the literature has substantiated the whole concept of tissue priming. So if you're going to be planting seeds in the soil, what can we do to maximize the health of the soil? And this is the list of the current things that are available to us to prime the soil. We've also learned a lot in our research. We looked at utilizing stromal vascular fraction for various aesthetic improvements. And that's when I met Nathan Bryan, who is one of the world's foremost authorities on nitric oxide. So anyone who's involved in any forms of therapy that we're talking about tonight, we utilize nitric oxide both topically as well as orally as an enhanced vehicle of absorption. So everything that we're talking about tonight is enhancing the skin of your patient to improve absorption, to improve the success rate of the absorption of any product that we're utilizing the DEP for. And these are two great references on nitric oxide that Nathan has written, and also he now has his third book that has been recently published And so this is really great reading material to help you understand how you can improve your patient's absorption. These are some of the articles that we utilize the DEP technology in. We published one of the first articles in April of 2021 utilizing mesenchymal stem cell derived exosomes for aging skin, and we utilized the DEP to deliver the exosomes into the tissue. We were also one of numerous international centers for showing the whole field of bioregenerative effects of calcium hydroxylapatite or radius. And what we showed was that by pre-treating the skin prior to the injection of CAHA, utilizing exosomes, that patients got a better result quicker. And we also then utilized the DEP system in this publication for delivering exosomes into the tissue. And we found that if we pre-treated the tissue with the combination that I'll show you, utilizing nitric oxide serum and exosomes, that patients got a better result quicker. So this technology has really been one of the most interesting and patient-friendly technologies that we've introduced into our practice over the last 30 years. Uh, I've had the privilege of working with this system for going on now 4 years, and we've really learned a lot about it and learned how to master its utilization. Uh, and so again, the approach of this really addresses many challenges that patients have expressed. Patients don't like pain, and if you're not sensitive to a patient's dislike of pain, then you're not really taking good care of patients. You're really just doing things to them. So things like the Pronox system, if you're not utilizing Pronox, you should look into it because again, in any patient that you're doing anything for wants the maximum comfort. And the DEP system allows us now, again, to deliver products into the dermis without utilizing needles. And it takes advantage of utilizing electrical current to propel products through water or saline-based channels. And this is the actual system itself. You have the ability of controlling the electrical current that's delivered through the handpiece. But this is really an important instrument. I'm going to highlight this throughout the course of the talk. When many patients have, when many utilizers of the DEP have called me saying, you know, we want to maximize our ability of utilizing this. This is your most valuable tool on the system. This is an impedance monitor. You can think of the tissue as a glass, and you're wanting to fill that glass with water. And you want some feedback to know when the glass is full and when the glass isn't full if you're wanting a full glass. And so this is the monitor that you're watching while you're doing the system, because when you start, all of the LED lights will be going over very far to the right. And as you continue to distribute the product into the dermis, the length of the lights will decrease. And once you've filled up the glass, the lights don't move. And this has been probably the biggest mistake when patients have said they're struggling, is that they're not utilizing the impedance monitor in the method that they should be. You don't leave an area until the lights stop flashing, and that's what gives you the maximum form of absorption. There's also a vibratory mechanism for the patient, which helps them then to experience less discomfort, although very few patients experience any discomfort. Perhaps when you're over, closer to the teeth, when you're doing the upper or the lower lip, or over the malar area when you're closer to bone. But the vibratory system, it follows what we refer to as the gate theory of pain. If you can distract the patient again, they feel less discomfort with this. So dermal electroporation takes advantage of this non-invasive technology that employs electrical pulses to enhance the permeability of skin. And by utilizing electrical current, we create microchannels in the dermis to allow active ingredients up to 800 Daltons to penetrate the dermis in a very even fashion. And the benefit again to you and your patients is this is a needle-free technology and a very precise mechanism. Depp has coined the phrase predictive permeation. And this is really what we do. We have now worked tirelessly. We have now done extensive work looking at what products can we deliver to what depth utilizing this system. And these are all things that we'll have in upcoming publications for DEP. So these electrical pulses again create these microchannels in the skin, and they allow for a deeper and more even penetration of active ingredients into the tissue as compared to utilizing needles, injection needles, or micro needles and micro needling as well. And so I'm currently working on a split face study where we're comparing depth to microneedling prior to the absorption. Many folks have thought that microneedling was a great way to get products into the skin. But when you microneedle or utilize needle radiofrequency, yes, you're creating these channels, but we've seen, and there's been publications that have shown that we're naive to think that these channels stay open very long because your tissue wants to heal itself. So you have a very short window of applying products to a microneedled area to get any maximum form of absorption. So again, limitations to needling, microneedling, needle radiofrequency have been the inability to consistently deliver effective and certainly patient-friendly results because even with the best of topical anesthetics, even with sometimes the Pronox systems, patients still feel too much when you're needling them. And many patients inherently, excellent reports and studies showing most patients, when they come for aesthetic treatments, have an inherent fear of needles. And when you're penetrating the tissue again, if a patient is on blood thinners, we're seeing more patients with atrial fib that are on Eliquis, on various blood thinners. Again, they will have bruising even from microneedling. And because of the uneven absorption based upon the early closure of some of these channels, again, we're seeing uneven absorption of many of these products. So predictive permeation allows us now a solution to address all of these limitations. And you're not only just doing something to the patient, but now you're taking good care of them by being cognizant of their comfort. And you and the patient want the same thing. You want results. So you want to give them the results in the most comfortable setting that you can do this. So it's really this electrical pulse technology and the feedback mechanism that the system gives you to propel the products into the dermis in a controlled fashion. And now you have the feedback mechanism with the impedance monitoring that tells you when the glass is essentially full of the product you're wanting to deliver. And so again, this creation of these microchannels has been really revolutionary in this whole field of what we're doing. So this then allows us now to look at, every patient is different with every complaint they're coming in with, and every patient is different with the tissue that we have. But they still come in with, there's three major signs of aging that we're looking at. Number one is the gravitational descent of their facial muscles. Number two is loss of volume. And number three is the loss of tone, quality, clarity of skin with loss of elasticity. And the number one side effect of hormonal changes in women in aging are pigment changes, pigment variation. So this allows us then to create various soups of different products that we know will work for these various problems. Hyaluronic acid is one of our mainstays of utilization in this field of the regenerative medicine boom. Utilizing topical exosomes allows us again to improve the tone, quality, texture of skin. Other additives such as PDRN also it helps to improve the quality of skin. And there are many other applications and multimodality capabilities for which we're devising various soups that will be available through DEP with this. Another very valuable addition to this armamentarium is adding botulinum toxin. Remember, when you were utilizing toxins daily into muscles to decrease muscular activity, but we know that by adding micro droplets of botulinum into the dermis helps to relax the smooth muscle in the sweat glands, and this then in turn relaxes the fine static retids. So one of the most common combinations that we utilize, and these are the areas primarily that I'll be showing you, and the easiest areas to incorporate DEP into your aesthetic practices would be number one for aging skin, number two for acne, number three for alopecia, but then also for other areas such as sexual health, such as cellulite. And these are all areas that we will help you achieve success. And it's in appreciating, again, what combinations of products can we utilize. So combining toxins with hyaluronic acid, with growth factors, and all of these other additives really help us to improve whatever the patient is coming in wanting to improve. As I'll show you also for hyperhidrosis. For hyperhidrosis, we're having to inject toxins into the palms, into the soles of the feet, into the axilla, and many times inject these patients hundreds of times. These are extremely painful areas to inject. And so now we have a non-needle form of therapy for these areas. So again, this has really been life-changing for these patients. So skin rejuvenation, hyperpigmentation, acne, alopecia, these are the easy ones. And then into more medical areas, things such as more dermatological issues such as rosacea, eczema. These are also very doable. Hyperhidrosis and stria are also things that we will show you this evening. Anyone associated in these fields also, meticulous photography is a necessity, because for all of the things that we're talking about tonight, the results for these patients can be subtle over time. And so you need, gone are the days where just showing a patient a two-dimensional photograph and trying to talk them into the fact that they might look a little bit better is acceptable. Patients are more savvy than this now. And so all of the photographs that I'm showing you tonight, we've taken. Quantificare is one of many systems. Canfield has a system. I choose the Quantificare system because of its versatility and its compact nature. But the Quantificare system and many of the photographs that I'm showing you, Quantificare measures quantitatively wrinkles, pores, evenness of skin, oiliness, pigmentation, as well as vascularity. And every picture that you take shows the patient then a graph ranging from +10 to -10. Quantificare has a patient database of well over 20,000 patients, and a +10 represents the top 2.5th percentile of Quantificare's best result patient, and a -10 represents the lowest 2.5th percentile of their worst patient. And their database is age-related, sex-related, and race-related. And that's the other beauty of Quantificare, again, is we'll show you the benefits of utilizing this in all of the Fitzpatrick skin types. So DEP is also colorblind. Many patients who are Asian, Mediterranean, Hispanic, African American, Indian, because they are prone to PIH or post-inflammatory hyperpigmentation, if you use things like traditional microneedling or needle radiofrequency, you can create intense post-inflammatory hyperpigmentation. So now we have a way again to distribute these products into the dermis of any skin type, any skin color without needles. And so again, starting with again aging skin. Again, these are all after one treatment after 30 days, and with this combination, again, we're utilizing a combination of 1 cc of hyaluronic acid, 1 ml of exosomes, 1 ml of botulinum at a dilution of 4 to 1 for if we're talking about Botox, cosmetic, or Zeman. So this is essentially 25 units of botulinum. And you can see she just looks healthier. The overall tone of her skin looks better. Some of her pigmentation has also improved, more thanks to the exosomes. If we're dealing with pigmentation, we will add things like kojic acid, mandelic acid, some retinol as well in proportions again that we will have pre-made vials that'll be available through DEP. And again, when you look at her quantificare evaluation, and so again, here she is before, and so after. So look, wrinkles improve, pores improve, evenness before and after improves, her oiliness improves, as does her pigmentation and her vascularity. And again, these people simply look healthier. Uh, And so again, there you can see that some of her redness has improved, but some of her pigmentation is better. She just looks healthier. She looks better. She looks her best. And again, these are all 30 days after a single application. And remember, it's not it's not the tool, it's the user. And knowing how to utilize this is very important. And knowing what combinations of products to use when, on which patient, is very important. So you can see her pigmentation has improved, but look at even after one application, look at how a lot of the fine lines in the lower third of her face have improved. As with this gentleman, again, his pigmentation has improved a lot of his fine lines. He just looks healthier. Uh, and so again, some of these patients are involved in the study that we did looking at hyperdilute radius. We know that hyperdilute radius, or CAHA, can help to bioregenerate collagen type 1 and 3 elastin as well as the proteoglycans. But we showed that pre-treating the tissue with exosomes, utilizing the DEP to deliver them, gives them a better result quicker. So here was the biostimulatory dermal infusion with DEP. So you can see her pores improved. Again, here's another patient, her wrinkles improved. This was a hyperdilute CAHA patient. So you can see again, her pores improved. And here's when we pre-treated with DEP and exosomes prior to doing this, she got a better result quicker. So even at 21 days, we were seeing an improvement in the tone and quality of her skin. We implement this also not only on the face. When we utilize increase in volumization, utilizing hyperdilute CAHA in combination with full strength CAHA in the buttock, but also then in our cellulite patients. Again, pre-treating with exosomes and then treating with hyperdilute CAHA, you can see, and again, this is a topographical map. So it's showing you the increase in topography or the decreased volume in the cellulitic areas after a single application. As with this patient, when we combine volumization as well as the topical application of the combination of 1 ml of hyaluronic acid, 25 units of botulinum, and 1 ml of exosomes, you can see with the 3D quantificare system, you can see that, again, look at the tone and quality of her skin around her mouth. We've given her increased volumization in her lips and in her malar area, but she just looks healthier. And in her lip area where we utilized, again, some HA filler in her lips, but she doesn't look done. This has the silhouette feature again where you can show where she was and where she is currently. So again, she just looks better. She just looks healthier after a single application utilizing the DEP to improve the absorption. Again, the DEP is colorblind as well, so you can treat all skin types. So for melasma, again, patients with acne who are not Caucasian, who are not types 1 to 3, they also get PIH or post-inflammatory hyperpigmentation. So again, this patient is 30 days after a single application. Again, combining the soup that we mentioned, utilizing topical exosomes, utilizing botulinum, utilizing HA, but we also add some mandelic acid, some kojic acid to this, as well as some retinol, and we get a nice blending of her pigment. As with this patient again had an attempt at tear trough injections, which again, just the trauma of injecting gave her hyperpigmentation in her tear troughs. And so in this instance, this is now 3 months after monthly applications of our pigment recipes to help her pigmentation improve. In this Hispanic patient, again, 1 month after a single treatment, again, we're starting to work. Remember, melasma is hormonally induced. So no one, whether it's you, whether it's me, will rid a patient of their melasma, but we can lighten it several shades. And the depth gives us, and in a patient like these patients who are types 3 to 6, anything that you do that penetrates the skin will cause post-inflammatory hyperpigmentation and make their pigmentation worse. So that's another benefit of the DEP in types 3 to 6 patients is you can deliver the therapeutic products into their dermis without risking more hyperpigmentation, as with this patient. Again, so we get her in 2 months from the left to the right. So you can see her PIH areas are improving, but she's just looking healthier. She's looking better. As with this patient again, who's of mixed ethnic origin, but again, very prone to PIH, very still prone to periodic. She gets bad acne with her periods every month, and now we have her under control. And I can tell you that this is an example of one of the reasons I still love what I do after 34 years, because I can tell you that the improvement in self-esteem, you can see it in her eyes from left to right. These are incredibly devastating to her self-esteem, and now we have her under control really after 1 month after a single treatment. Here we are 60. Some patients are more refractory. She has a combination of rosacea and acne, but we get her from there to there 60 days after 2 treatments with the customized formulary recipes that we utilize. From a scar therapy standpoint, again, this is a midline hypertrophic scar that we've been treating with our combination therapy, utilizing different energy devices, but utilizing the depth then once we have the scar flat to help decrease the hyperpigmentation. For hypertrophic scars, again, delivering therapeutic agents into the hypertrophic scar helps revert scarring to a more normalized scar appearance. Mark Nestor did a tremendous study on the value of utilizing the DEP for hyperhidrosis, where he used starch iodine testing, and he showed that again that we were getting adequate absorption with dermal electroporation with botulinum to effectively treat hyperhidrosis. And we've now replicated this in the axilla, on the palms, on the soles of feet of people, and seen beautiful results. So alopecia, or thinning hair, has now taken over aging skin for the #1 adverse effect on self-esteem for both women and men. And so for our alopecia patients, there's tremendous science in 3 areas: LED light therapy, utilizing either PRP or PRFM, and now exosomes on the scalp. Again, these things don't magically regrow hair, but they do 3 things. #1, they decrease shedding. #2, they improve the blood supply of the scalp. And #3, we've been able to show histologically an increase in the dermal papilla cells of the follicle. So these techniques make whatever a patient has look thicker. So all of these patients essentially are 3 exosome treatments topically every month, and then we follow them up at 6 months. So everything that they have looks thicker. So I've really shown you a combination of all of the different ways that we can utilize dermatoelectroporation for a variety of many different treatments. And in our upcoming seminars, again, we'll be improving, one thing that I hadn't touched on now for sexual health, for both male sexual health and female sexual health. For all of our G-spot injections, O-spot injections, when we pre-treat the tissue with a combination of exosomes, again, we see a better result. Many patients, many elderly patients, again, have painful sexual intercourse and problems with urinary incontinence and sometimes fecal incontinence. So we know that intravaginal fractionated carbon dioxide therapy with exosomes internally on a tampon help the patients with this. But externally, then, when we use the DEP to deliver these same recipes to the perineum, it really has given us similar results to anterior posterior repairs, where we've seen a reduction in urinary incontinence and fecal incontinence in some patients. So this really provides us with an instrument that gives us multiple applications to help patients with multiple aesthetic needs. So again, this is a needle-free administration that has no downtime, allows us versatile applications with consistent and precise absorption. Once again, predictable permeation is a concept that DEP coined. And these really, from a practice standpoint, it really enables you to show your patients that you're wanting to take good care of them and not just do things to them. So all of the things that are important to a patient, like pain, like downtime, we've essentially eliminated. We have a high consistency of delivery in this modality and extreme versatility. So this has really put our patients at ease. And once you take good care of a patient with this, it's really been remarkable the number of their friends that they will tell. Because again, no one likes needles, and really no one likes downtime. And so we've been, again, working tirelessly with DEP to maximize the applications and to maximize the different modalities for which we can utilize this. And we'll be coming out in the next months with different recipes and different manners for that you can introduce this technology to your practice. And so again, this allows you, again, from a marketing standpoint, this is really viewed by our patients as a very high-tech device, which differentiates you from the rest of the marketplace. Be a leader in taking good care of your patients, not just doing things to them. This also, because you're not having to spend as much time on patient comfort, it also allows you to do these procedures faster. And again, if you haven't, you need to do a per room, per hour revenue evaluation. And you need to maximize the time and the procedures that you're performing in a decreased amount of time. And if you take good care of the patient and not hurt them, they're naturally going to be more satisfied than those patients who are afraid of nurses, afraid of needles. And they will tell several of their family members and friends. And the beauty of this is also a very simple instrument to utilize. And it's extremely difficult, if not impossible, to hurt someone with this. The integration of this into your practice, I compliment David and his team again on their comprehensive training. Remember, it's important to the DEP people that you learn how to utilize this instrumentation and that you utilize it properly. And so again, there is training available as well as marketing support and ongoing assistance that I find has far superseded any of the energy companies that I've also had the privilege to do work for. These are the various manners for which you can contact DEP, that you can call them or email them. And I know that they have for attendees at the various webinars, again, that they have some pricing available for that. That's also when you compare the price of the DEP machine to the prices of even things like microneedling handheld devices. The return on investment is very quick. and very fast with this. And so, having said all of that, I'm happy to open things up for questioning. If anyone has any questions. And so, Mariska, if you can, I would ask that you identify yourselves and where you're from prior to asking any questions. And I'm really happy to entertain any questions that you might have. David, I'm not sure if you are on or are unable to unmute yourself. But Mariska, if you can unmute folks, then we can go ahead.
Okay.
Dr. Chernoff.
Good.
David, go ahead. I'm going to try and unmute people as well.
Okay. So, Dr. Chernoff, can you hear me okay now?
Yes.
Apologize for the earlier distraction. So, Nancy, whom I believe is in California, would like to know the precise protocol used when treating neuromodulars, especially the enlarged pores. She says, thank you.
That's a great question. So again, aging skin and enlarged pores would be the same soup that we utilize. And so we utilize 25 units of botulinum in 1 cc. So most of these soups we make in 3 to 5 cc aliquots. But 3 cc's of an entire soup. So one ml of botulinum or 25 units, 1 ml of whatever exosome that you are utilizing, and 1 ml of hyaluronic, a very low G prime hyaluronic solution. It gives you an emulsion then that is very easily absorbed. And that will help not only the reduction of static retids, but also the reduction of pores. And typically it really takes 30 days, we found, for all of the effects of any of these treatments to give the maximum result. And so we offer packages of these that patients can do monthly. But again, it's so important. Patients will see results even after a first treatment. And so photographing these patients before you do anything for them and at each visit is really very important because that, again, quantifies the results that you're producing for your patient.
Okay, so the next question comes from Dr. Mansour. I'm not sure where he is located. His first question, you were going to answer. The second one, I think you just did. So the first question is, can DEP be applied topically over skin of genitals? Is his question.
Yes.
Okay.
So
the second question you just did.
But I guess you need to charge them more because of the vibratory effect. Also, that makes them smile more. Yeah.
His next question that you did answer, what is the combination or ratio of the amounts of the tox, HA, and exosome? So yes, we did cover that. Are there any other questions? These are the ones I'm currently seeing in the chat box.
And David can also, if you have other questions that we haven't answered tonight, David can also forward them to me, and we'll get back to you.
So, Dr. Mansour, again, does DEP replace P-shot?
So I wouldn't, when you ask a question like that, so questions like that, I would only answer a yes or no to if we had a controlled clinical trial showing the efficacy of that. I would say that everything that we're doing would suggest that yes, it does. But that's one of the trials that we are embarking upon with DEP right now. Our next, once you know that something works, then you work feverishly to make it work better. So we're now working on different soup combinations and expanded applications that DEP will make available to all of its users.
So he has a follow-up statement. It says, or an alternative to the shot. And I can kind of answer that. There are clinicians across the country that are utilizing the DEP in lieu of injecting regenerative products, et cetera, into the male genitalia. But again, as Dr. Chernoff stated, we don't have any controlled clinical evidence, and therefore we just kind of don't want to go down that road right now. So Nancy, are we worried about the depth of the neuromodulators? Can it go too deep and prevent muscle movements?
So no, you're not. So no, that from a depth of penetration standpoint, the depth won't be penetrating down to where the muscles are. We've not seen that in hundreds of cases now.
Okay. So let me scroll down. That was okay. If anybody else has any other questions,
These are all
there we
great
go.
questions as well.
Faye, does this soup help with lip lines?
Yes, definitely. And this is where again lips hurt the most, and so this is where the patients have been the most appreciative of DEP is in the perioral region, especially with lip lines. The botulinum, again, because prior to DEP, we were utilizing, multiple aliquots that we would inject into the upper and lower lip line of botulinum. And that hurts a lot. And so all of these patients were the most grateful when we introduced this to our offices.
Okay. She says thank you. And again, Nancy, regarding HA, are we talking about the same thing we use for fillers?
So DEP currently has an available HA that you can purchase. That's a solution that we found works equally as well. When we first started out, we started using some of the low G prime HAs, but again, that drives costs up, and DEP now has an available vial of HA that you can utilize that works equally as well.
Yes, it's a 3% high molecular weight product. It helps keep things superficial that you would like delivered more superficially into, say, the papillary dermis. And Nancy follows up with awesome. Thank you, Nancy. That's very kind. Anybody else? Okay. Well, if there is no one else, I first would like to apologize
Sorry,
for our.
I have one more question.
Oh, okay. Jump in.
Sorry. Um, so I was just talking to David about this. I have a patient who's pediatric, 6-year-old with alopecia areata. Would the DEP with exosomes be helpful, indicated? Because I know that as a pediatric client, they have a lot of exosomes.
So I'm not, you said as a pediatric client, they what about exosomes?
They have a lot of stem cells, they have a lot of exosomes, and so I'm just curious, like, would you use DEP with exosomes on a pediatric patient who's 6 years old? Um, if,
What's your hesitancy in using them on a 6-year-old? That
um, well, I guess my hesitance is because I know that they have an abundance of exosomes and stem cells, and so I don't know if it's even if it would even
they have
be beneficial.
they have their own stem cells and exosomes for which aren't working for the problem that they have. And
Mm,
so you're utilizing and it also depends on your source of exosomes as well, but you're utilizing an external graft, if you will, to attempt to help a problem that their own body is not taking care of. And you're using a product that really it has next to a zero chance of hurting them. And so there's really nothing to lose by trying.
okay. Does STEP currently offer exosomes, like an exosome source?
David?
Yes, we do. And I can talk to you about
Okay.
that offline, Nancy, of course. You know how to reach me.
Okay. Thanks.
You're welcome. Anybody else would like to chime in, either verbally or on the chat?
These were all great questions tonight,
Yeah,
everyone. Thank you.
definitely. Okay, well, I'm going to apologize again profusely for our technical issues, and I am eternally grateful, Dr. Chernoff, for this presentation. It was wonderful. It was informative. Um, I appreciate your help and your support as usual. And I would like to say thank you to everyone who attended this evening. We hope you learned something, and we hope that we hear from you soon. Thank you very much, everyone, for your time. and have a good night.
Good night.